Hello and welcome to EyeMedics Podcast, a place where you get trusted insights, treatments, and updates on eye health. I'm your host, Bindu, and today we're going to talk about a condition that affects all of us, presbyopia. What is it? What happens when you have this condition? And what do you need to do? To answer this and more, we have with us Ms. Shakti Thakur, the lead consultant and medical retina expert at EyeMedics. Welcome, Ms. Thakur.
Thank you so much, Bindu.
So let's start at the very beginning. What is presbyopia?
So this is actually a natural process. It's part of the aging, dare I say. It's a mechanism, the normal mechanism that allows us to view things at a short distance, so typically reading distance, is achieved by contraction of a muscle, a circular muscle, that is in the iris. That's the colored part of next to the iris, around the iris. And when it contracts, when that ring contracts, it relaxes the lens. And the natural lens in the eye, when we are young, is able to change its shape. As it changes its shape, it allows an increase in focus. It allows us to focus on things that are near. So that is a process that occurs automatically as we look from far to near. Those muscles contract and relax by themselves, and it's accompanied by a change in the size of the pupil. So the pupil becomes smaller when you're looking at something closer. And the third thing is that the eyes, instead of looking straight ahead, the two eyes come inwards so that you're converging to look for something, looking at something that's closer to you. So those are the three mechanisms that occur automatically when we look at something close up. And unfortunately, when we get to our 40s, mid-40s, that mechanism fails. People really still don't understand why it fails, but in everybody, it fails.
So does this mean that everyone will suffer from this particular condition?
Yes, with two exceptions. The exception being that if you are myopic, so you have glasses for distance, and you're typically about -2, -3, -4 in your prescription, and you get to that age where most people are requiring reading glasses, all you have to do is take your glasses off, because taking your glasses off will automatically give you the remainder of the correction that you need to see something close up. And for some people who are lucky enough to have one eye that is normal and the other eye that is short-sighted, essentially they can do the same. They can manage, because one eye, you're able to see things close up without the glasses.
Got it. So what are the three symptoms to look out for to see if you have presbyopia or not?
Very typically, people start to struggle reading smaller print, or instead of reading things at a distance of about 20 to 30 centimeters, they're having to move it further away. And then you can see it. But when they bring it closer, it goes blurred. And some people will get a little bit of discomfort, typically in the sort of this part. You can feel the kind of strain.
But that's the central part of the forehead. Okay.
Yeah. It's just straining the muscles, and you can feel that strain.
Right. So what are the treatments, or is there no treatment?
Well, for centuries, we have been using very simple reading glasses, which works for most people. And of course, you may start off with a lower power, and as time goes on, that power may increase, but it's simple, it's affordable, it works for most people. If you were to have cataract surgery done, then there is the option of your surgeon choosing a lens implant that not only corrects for your distance vision, but also has the option of correcting for near, so sort of the equivalent of a multifocal, varifocal lens that people have in their glasses, but you can have the equivalent of that in your eye. And there are now a host of different options, again, being explored to find the ideal kind of implant, which gives you a little bit more focus. There are pros and cons of the different lenses, and that's a sort of detailed conversation that patients
For
would
another
need to have
podcast.
their surgeon. Yeah. Those are the main two options.
Okay.
But there is one new thing.
I know, which is what I was going to ask you. This eye drop that everybody's talking about for presbyopia. What is that? I mean, has it come out of the blue, or is that something that has been in the works for a long time and is finally in the market now? Is it the magic potion that the eyes need?
It's a great question. So it's based on a very old-fashioned drop that we used to use for treating glaucoma. That drop was called pilocarpine. It's still around. It's not used as commonly. But the side effect of that drop is that it makes the pupil smaller. And when the pupil is smaller, going back to how I started, one of the three mechanisms of this process of focusing for near that we call accommodation. So if it makes the pupil smaller, it gives you a little bit more focus for near. So we call it extended depth of focus. But pilocarpine has been tried in different strengths. There are various studies. So there was the Virgo study, the Gemini study, and the near 1 and 2. The problem with pilocarpine drops is that the pull that they exert on that muscle, if you imagine, because they're causing the pupil to constrict, that pull is also exerted back into the periphery of the retina. So if you have any kind of areas of weakness, which are typical in patients who are short-sighted, so if you're myopic and you've got what we call lattice degeneration, areas of weakness, then there is a slightly increased risk maybe of retinal detachment. So that's something you've got to be a little bit wary of. The newest kid on the block is a drop called Vizz, V-I-Z-Z. It's called aceclidine. And this drop makes the pupils smaller, but it only acts on the very specific muscles affecting the actual pupil size without affecting any tension in the retina. In theory, it is possible that it is safer than the other drops. And one drop a day will certainly make the pupil size smaller. Again, they've done studies called the Clarity studies, and it seems to work. So patients get a little bit of, or they get significant improvement in their reading vision. It doesn't compromise their distance vision. Side effects are tolerable and mild. Some people get a little bit of discomfort with the drops, a little bit of headache, but it seems to be tolerated well. It's not widely available yet. It's been approved by the FDA in the US. There's an interesting cost to it. Would I put it in my eyes? I think I'll stick with my glasses for now.
Got it. So what you're essentially saying is that there is an option available, but it's also fairly new. It's yet to be tested on a larger set of patients. It's been passed by FDA, so a lot of the side effects have already been considered. I guess over the next few months, we'll know more how these drops are working. Is everyone who suffers from presbyopia can use these, or is this a specific set of patients that you think should be using these drops as an ophthalmologist? And I won't hold you to that, though.
Sure. I think because it's a new product, we don't know long-term what the potential risks are. I would err on the side of caution. So if you don't have any degree of myopia more than -1 or -2, and you're in 40s to mid-50s, and you haven't had cataract surgery, and there's no family history of retinal detachment, and you want to try it, then I think you go to your optician, make sure you have a proper retinal exam and all is well, and then you can give it a go. But if there's any more myopia than that, or any family history of retinal detachment, or any other retinal problems, I would probably steer clear of it until we have long-term data. And of course, it may not be suitable for people who work in low illumination environments or are doing a lot of things in the dark. So because the pupil also, a smaller pupil does dim your vision as well. So if you're already in a low luminance environment, that may not be the best thing for you.
Got it. So just to wrap up things for our listeners, are there any other treatments other than these eye drops and of course there are glasses, as you said, it's an age-old treatment and probably the safest and the best treatment. Is there anything else that patients who suffer from presbyopia could possibly think of?
I mean, there are all sorts of refraction correction things. So I'm talking about LASIK, laser to correct distance vision. That's typically not used for near vision. And some patients like to have contact lenses that correct their near vision. So that there are a host of things that you can do. What is the safest? I'd say the glasses are still the safest option.
Yeah, and of course, all our listeners can also reach out to their ophthalmologist and try and understand what's the best treatment for them. Thank you so much for clearing all our questions and queries that we had with reference to presbyopia. Thank you once again for being here on the podcast. And to all our listeners, if you want more information about any of the subjects or topics that we talk about in our podcast, do visit our website, EyeMedics.co.uk. Until next time, take care of your eyes and remember, your vision is worth protecting.
Thank you so much.